Now, we would like to present the Keynote Session 1, and after it, we invite you to a coffee break. We invite Dr. Daniel Bas to come to stage. He's a biologist with a master's degrees in ecology and a doctorate in public health. He's the head of the Climate Change and Environmental Determinants of Health Unit at the Pan American Health Organization based in Washington, D.C. This unit coordinates PAHO, whose actions in the 35 countries and 18 territories of the Americas on issues such as climate change, quality water, sanitation and hygiene, waste management, chemical safety, and environmental, epidemiological, and toxicology.
Good morning again. Thank you very much for this invitation. It's very difficult to keep the quality after this excellent band and keeping you from coffee break. So I'll try to be brief, although I have some slides that I want to share with you. As you notice, I was speaking Spanish before, but here they asked me to do this presentation in English, so I hope it's okay. If not, we can switch or we can do a mix of languages. I can even speak some Portuguese. So thank you very much. I want to thank IWA and all the country representatives that invited us to be here today. Once again, on behalf of Dr. Jarbas Barbosa, the director of the Pan American Health Organization, and Maria Dolores Perez Rosales, the representative of PAHO in Uruguay. And special thanks to AIDIS as well, Juan Martín, Alejandro, ¿no? Fueron muy amables y muchas gracias por también invitarnos y por estar juntos. I was fortunate enough to prepare a presentation that I want to talk with you about water sanitation, hygiene, health and equity, which are key elements to achieve the SDGs. As we heard before, the achievement of the SDGs are at risk, and I'll show you some examples of that and maybe some opportunities as well on how to perhaps speed up what's left till 2030. I'll just start kind of flying high with the triple planetary crisis and the topics of climate change. Of course, we do work in the Pan American Health Organization. I'm based in Washington, D.C. We do work with 35 countries and 18 territories of the region of the Americas as the regional office for the World Health Organization for the Americas. And we see multiple challenges from Canada to the southern tip of Chile and Argentina, and the Caribbean in the middle, Central America, and the whole South America with its own problems that we are facing now. So I'm going to speak a little bit more about how climate change can exacerbate the other two dimensions of the triple planetary crisis. One of them, of course, being the air pollution, water pollution, and soil contamination and chemical contamination. And the third pillar of the triple planetary crisis, which is the biodiversity loss and loss of ecosystem services, which puts us in a very difficult situation, having to tackle the three challenges at once. Plus, in the region of the Americas, it is the most unequal region in the world. So where we have the poor living very close to the most rich people in the region, side by side, but they are facing entirely different lives, entirely different perspectives of lives because of the social, environmental, commercial, cultural determinants of health. So we have to acknowledge that if we want to come with integrated solutions as well. Here, I wasn't going to speak a lot on climate change on this topic, but I was inspired by the table before. And as some know, Carmen, Siganda, and I are working a lot on the topic of climate change as well in Uruguay. But to focus a little bit, not as much on the climate change part, although I'm going to speak about it, but a little bit about this topic here. So vulnerabilities. Who are the vulnerable peoples of the Americas, and to what they are vulnerable to? And the elements of vulnerability, one of them is related with the demographic factors, the social, economic factors, the biological factors, where these people live, who they are, what are conditions, what are the environmental conditions where in the regions where they live, but also another important topic of vulnerability, for health vulnerability, is the condition of health systems. So first of all, we don't have full access to health in the Americas. We don't have hospitals and health centers everywhere for everyone that works all the time. And part of it is because of we do not have water, sanitation, and hygiene decent enough in healthcare facilities. So imagine you're a doctor or you're a patient and you have to wash your hands to perform a surgery with contaminated water. Or how to perform a surgery or any interventions without electricity in a hospital. And this is sadly the situation of many healthcare facilities in the region of the Americas. So these are the elements that can increase or reduce vulnerabilities to climate change or to anything else, right? To disease, to infectious disease. But here, since I have this slide on climate change is exacerbating more than anything. It's causing new threats to health, but also it's exacerbating the problems associated with the current deficiencies in the system. And I want to show you in the next slides a little bit of what are the deficiencies that we have in the region of the Americas, some of them on drinking water, sanitation, and wash in healthcare facilities. And this is a sad expression of the inequities that we have in the region of the Americas. So you can have a very complex hospital delivering high-quality services, and if you travel 100 kilometers or 80 kilometers from there, you might have not even the basic access to health services somewhere, or to water and sanitation services. So drinking water services in Latin America and the Caribbean, 1 in 4 persons, 25%, 1 in 4 persons in the Americas in 2024 still lack safely managed drinking water services. This is a sad number. We should all be ashamed of it, and we should all be, and I think that most of us, or all of us here, are working to change these numbers. The great majority lives in rural areas. So I say it's almost 85% of these people are in rural areas. But even in urban areas, 20% of the population is still lacking safely managed drinking water services. So we need to address these issues, and I'm going to address the SDGs in a moment as well. On safely managed sanitation services, it's even worse, right? So more than half of the Latin American, the Caribbean population lacks safely managed sanitation services. 336 million people. These numbers vary depending on who's measuring. These are data from WHO, UNICEF. And 9.1 million people still practice open defecation in the Americas. That's obviously is a threat to health. It's obviously a threat to water as well, water quality, and most of them are in rural areas. But also there's a gap in urban areas where half the urban population still don't have access to safely managed sanitation services. We have a large gap to cover. And with regards to water sanitation and hygiene services in healthcare facilities in Latin America and the Caribbean. So half, more than half, or a little under half, right, do not have access to drinking water qualities that attend the norms of the World Health Organization, for example. So again, you know, how can you imagine someone performing any medical activity with water contamination in their healthcare facilities? 58% of the hospitals were connected to public sanitation networks, which means that over 40% are not connected to any sanitation networks, thus contaminating potentially the environment and the people. 33%, a third, had toilets designed for people with reduced mortality. This is something else that we need to increase access to people with discapacities in the region. 60% of the hospitals or healthcare facilities had toilets with water and soap, meaning that 40% didn't even have soap for people to wash hands in healthcare facilities. 47% kept records of waste generated by the facility, meaning that most facilities do not even know the amounts of waste that are generated in healthcare facilities. And a third had some adequate storage facilities for contaminated waste. And during the pandemic, where no one was really prepared, this situation exploded, right? We had to deal with large amounts of plastic and gloves and masks, potentially contaminated, and countries not having place to adequately storage and treat those contaminated waste. In many cases, these healthcare facilities, they simply incinerated all this material, thus generating air quality problems included in the region where it was generated. So it's a snowball effect of problems that we had to address. This is important because I already spoke about some data rights of the water sanitation and hygiene part, but the important thing here is that this is the health impacts attributable to preventable environmental risks in the Americas. Meaning if we work with water sanitation and hygiene, if we improve air pollution, if we manage to inform and have activities to prevent exposure to chemical hazards, we can reduce this 1 million deaths per year, premature deaths, as we call, due to environmental risks in the Americas. And if we see the difference between the percentage of deaths attributable to environmental factors in high-income countries, 13%, to 19% in low and middle-income countries, we see that the disparity is mostly because of the social determinants of health and the social and environmental determinants of health. There is a difference of living in a poor country, you're more exposed to all of these effects, or poor regions or poor communities, than if you live in a high-income country. And climate change not only creates new challenges, but like I said, it exacerbates the problems associated with lack of wash, with air pollution, and in many cases, exposure to chemicals as well. Adding a little bit of spice in that discussion, we faced last year a moderate to strong El Nino effect that on its own, it's not related with climate change, right? But on its own, it produced new challenges, a scenario where climate change is already high impact, exacerbating those deficiencies, and a situation with a moderate to strong El Nino. And this year, as we advance, we are expected to see a La Nina, and some effects are already being felt. And as you can see, I'm not going into detail about that. We had multiple trainings for health care professionals, but also for all the interested communities on these topics, and in preparation to El Nino, La Nina, which is being particularly strong in this part of the world. And what we saw and what we are still seeing everywhere, right? I could have put here, for example, Uruguay, the drought last year, the floods this year, right? Brazil in the north, severe droughts, then severe flooding afterwards. In the south of Brazil, the same, severe floodings as well this year. Wildfires, heat waves, flooding, and droughts, and all happening very quickly in a single place. And the health systems, and when I say health systems, I'm not talking about the health sector, right? I'm talking about the sectors that determine health, including water, sanitation, and hygiene, including energy, including economy, including tourism, including agriculture. So the health determining sectors, or the health systems, must cope with these responses and be prepared and able to respond quickly to those problems. So this calls the attention of impacts and inequities, once again. Because the thing is, the persons who do not have access to clean water or sanitation very likely are the same ones that are affected by poor air quality. The same ones that are more exposed to chemical risks are the same ones that do not have proper access to health care, are the same ones who have lower income levels, are the same ones who have lower education levels. And these are the people that we need to pay particular attention and work to leave no one behind. That's one of the mottos of the SDGs. Right? So if we mean to pursue, and I think we should, and I think we must, and I think we have to achieve SDG 6 by 2030, so this is the size of the challenge. We need in Latin America and the Caribbean to deliver to 23.3 million people per year. This was data from last year, right? So probably this data will change by the end of this year. But 23.3 million people per year to receive safely managed drinking water services. And 48 million people per year to receive safely managed sanitation services. This is the size of the challenges, ladies and gentlemen. There's also some opportunities. I'm not going to paint a bad picture and not giving any ideas on how to move ahead to solve the agenda. So now let's try to move to the brighter side of this presentation. So some opportunities, and one of them is understanding that investing in water, sanitation, and hygiene is investing in health. Dr. Siganda spoke about that. We have, at the Pan American Health Organization, launched this elimination initiative, which is an initiative by health systems, again, or meaning all the health determining sectors, including the health sector itself, to eliminate all those diseases from the region of the Americas. And we are working hard with countries to eliminate them. But we do have two that are elimination of environmental risks. One of them is eliminating open defecation in the Americas. The other one is eliminating the using of polluting biomass in households to cook and to heat. Wood or kerosene and other contaminants, air contaminants. So if we invest in water sanitation and hygiene, we can succeed in eliminating or making progress on eliminating a number of these diseases. So I'm going to speak a little bit now about some resources, some ideas, some materials that we do have at the World Health Organization, at the Pan American Health Organization, and as part of our technical cooperation, to improve WASH, to improve health conditions, and to improve health equity, meaning delivering services, health services, and the highest attainable health standards to everyone, everywhere. One of them is the Safe Drinking Water Framework, and within it, the water safety plans. I know that this afternoon we're going to have a workshop. Philip and others are here to talk about the water safety plans. And I think it's an excellent example on how to advance in delivering these three objectives: WASH, health conditions, and health equity. The second one is on integrated local or city-level policies and interventions. So a lot of the activities that happen and also rural areas, right? So local level of water sanitation and hygiene happen at the local level and not at the highest levels. So we need to work with all the levels to make sure that we deliver the highest attainable quality. Water safety plans for small water supplies, so paying special attention to areas or to household water supplies and making sure that we can also operate at that level. Strategies to reduce open defecation and to eliminate disease transmission. I was talking, so here some guidance on how to eliminate or how to work with WASH and making sure that we are addressing the neglected tropical diseases, and WASH, improved and sustainable healthcare facilities. So a little bit on that. I'm not going to talk largely about that because, like I announced, we are going to have a session later today. But the guidelines for drinking water quality from WHO that has the water safety plans as one of the main goals to achieve health-based targets. It links with a system assessment, monitoring of information management and communication, and delivering and strengthening surveillance systems in order to understand and to produce public health context and health outcomes. And this manual, water safety plan manual, that soon is coming in Spanish. So if you're interested, just click or photo the QR code. This presentation is also available for you if you are interested. And then you can have access to these Plan de Seguridad del Agua. So very importantly, and in a snapshot, so the water safety plans is a proactive risk-based approach. It aims to consistently ensure safe, acceptable, and adequate drinking water supply, and encompasses the entire drinking water supply from catchment to user. So as you can see, it means to address all the steps along the way and making sure as well that we have safely managed drinking water services with a health outcome vision associated to that. My colleague from WHO, Jennifer de France, already mentioned 90 countries in the world have implemented these water safety plans at the global level, at the country level. But also, it's important that we talk about the climate resilient city and local water safety plans. So where you can project in each situation, in each city or local level, depending on how detailed you want to work with, on what are the projections for that area, and then creating locally tailored solutions, but incorporating different future scenarios to it. We do have at the Pan American Health Organization is these courses, climate resilient water safety plans, climate resilient sanitation safety plans, the same in Spanish, where the idea is to strengthen these systems to become climate resilient, to incorporate the logic of projecting long-term, mid and long-term changes in a single region, and then addressing these challenges as we are doing the planning now. So we are not just ready for what's happening now, but also we are getting ready for what's coming in the future. And that's paramount considering all the situations that I showed you with maybe 1 year a region can face a drought, and then 6 months later a heavy flooding, or heat waves along the way, or multiple outbreaks of potentially dengue in the region. So it's very important that that these plans are developed and tailored to each condition, taking into consideration future climate scenarios, and making sure that the system is ready for whatever comes. And also, just a parenthesis here, but the idea is that we do work with the WASH services, and we have done at PAHO, 106 cities are now implementing these climate resilient water safety plans, but also to link this activity. It should not happen alone, only the WASH, but we have sophisticated tools as well at WHO and PAHO to work on green spaces and health co-benefit assessments. So if a city planner wants to create or remove a green space from a city, what are the expected avoided costs of hospitalizations, for example, due to heat waves, right? You can reduce heat island effects, or improved physical activity, or improvements in air quality. We do have also these tools to measure at the city level health impact assessments of air quality improvements and active transportation. So all these activities should happen together in a coherent way in order to maximize the health co-benefits of these activities. And this city-level package is one of the things that we are working now with countries in the Americas. Now thinking back again on water safety plans, but now considering the small water supplies, right? In households, communities, professional entities, community entities. Here in the Americas, we are seeing a spread of these initiatives that work at more local levels, that have proper governance associated to that. They have the monitoring of their own water standards, but following the national or provincial or state guidance. And these materials, I cannot strongly enough invite you to visit those materials, because they are paramount to advance and to close the gaps that I showed you in the beginning, especially in small water supplies, which are a significant amount of people who are now not being covered by quality services. We're going to hear about that as well in the afternoon. So a little bit on strategies to reduce open defecation. I'm showing you Guatemala, for example, and the country's efforts to drastically reduce open defecation using rural technologies, for example, on sanitation technologies, but also innovative ways of addressing and engaging with the local communities in the solution of the problems. These discussions on healthy housing as well, or viviendas saludables, which are activities that are still ongoing in the region of the Americas. But we still see the gap between urban and rural areas, for example, in Guatemala. So it's clear, and this repeats in every country, but we see where the challenges are. We can produce risk maps. We can also project with climate scenarios and then intervene in a more efficient way to cope with the problems that we are living now, but also getting ready for what's coming in the future. And a little bit on climate, on health infrastructure, but then adding the dimension of climate resilient health infrastructure, where WASH plays a major role. We know that health sector contributes to something between 3 and 10% of national greenhouse gas emissions. And most of the emissions come from the productive chain, but around 30%, depending on the country, is derived due to the healthcare facilities, because they have to operate 20 hours a day, 7 days a week. They have very expensive and energy-consuming equipments, large staff. And in the Americas, 77% of healthcare facilities are located in areas that are at risk of some climate disaster. And during a disaster, or soon after a disaster, a hurricane, flooding, droughts, an outbreak, is where you need the hospitals the most. So they cannot stop working. And we need to guarantee that people have access to those areas. So PAHO has a program called Smart Hospitals Project, among other activities on healthcare facilities. It has a strong component, for example, of rainwater collection, treatment, generating electricity with solar panels, and making sure that both systems can survive at least hours or days off-grid, right? So if the energy is cut, the hospital can continue to operate and has proper water running in its facilities. As well, it's also mostly in the Caribbean, they have to withstand Category 5 hurricanes that are more and more common or frequent in the region. And we do have a large number of materials on water, sanitation, hygiene in healthcare facilities, some of them as protocols. These are all in Spanish, but I can guide you through that in English. So protocols to evaluate, to assess water, sanitation, and hygiene in healthcare facilities, with particular attention to climate resilience, also some data that we have, and environmental cleaning and disinfection programs, wash press and wash fit, which are activities for water, sanitation, and hygiene, for preparation for emergencies, but also for the regular functioning of healthcare facilities with water, sanitation, and hygiene programs in place. And on healthcare waste management plans, now we are working with most countries in Latin America and the Caribbean to advance with new versions of healthcare waste management plans at the national level agreements, but also at the healthcare facility levels to improve the separation, the identification, separation, treatment, and final disposal of waste in healthcare facilities as well, making sure that these facilities are operational and are not generating impacts that later on are going to hurt health in return. So finally, my last slide, some ideas that I hope that we can continue to discuss. We heard some of them before in the opening session as well. So the first message is that improving safely managed wash services, water and sanitation services, and hygiene services as well, we could add that, for all people is the best investment in health. This is the key to achieve health. Big challenges, we do have big challenges. We saw the numbers, it's scary. But if you're a decision maker, or if you're talking with a decision maker, make them see that they can get big achievements. We saw that major improvements were possible in some countries recently. I showed you some examples on open defecation, but also these cost-effective sanitation technologies, where 3.7 million people more in the last 3 years were able to in Haiti, Bolivia, Colombia, Peru, Guatemala, and Honduras, in these countries alone, we are able to achieve almost 4 million people, new people, who are receiving now water sanitation and hygiene that are safely managed. We should create these programs that are problem-solving, right? So you want to solve a problem, but it's also evidence-based, so we need to improve our quality of information, and we need to improve our understanding of these linkages between climate change, water sanitation and hygiene, other determinants of health, and considering the social determinants of health that are interplaying in each community, and also the cosmovision, for example, of indigenous peoples or traditional people, that also comes as a complexity factor that needs to be taken into account if you want to deliver effective programs that are tailored to specific conditions and populations, and especially focusing on populations in situations of vulnerability, which are going to depend on what risks we are talking. So technologies are amazing, right? So we always think that's, well, why don't we create this new technology that are going to solve our problems? But without good management, these technologies alone are not going to solve the problems. So we really need to guarantee that we do have very good management, the engagement at all levels, from federal governments to local communities. All voices are heard, and we are discussing the solutions together and making sure that it's tailored and understood by the ones that are needing and receiving these solutions and being part of the solutions themselves. We need to build partnerships, and I think that this event, this conference, is aiming to do that. We are very fortunate to have, by PAHO and WHO side, IWA, AIDIS, the national institutions that are here in Uruguay, plus GIZ, the Swiss Corporation, and European Union, and so many others, the IDB, the World Bank, that are partners to deliver these, close these gaps and deliver these achievements. And we have to improve the ways to measure and account the results. In many cases, the investments on water sanitation and hygiene are done, and we don't have the proxy indicators for health or the proxy indicators of economics that can back us up to say, you see, so we are saving that amount of lives or reducing this capacity, and the cost of the intervention sometimes is lower than the benefits that are avoided in health expenditures, in hospitalizations, in deaths, in this capacity by the people. So we need to improve our ways to measure and account the results to make sure that we are changing the needle and the response to close the gaps that are huge. Not only in this region, I'm talking about the region of the Americas, but globally, but particularly in the region of the Americas, and particularly because we are such an unequal region. So we really need to improve those elements, and I think that some ideas are here, and I'm eager to hear more about you as well on more solutions, more ideas, and more ways to contribute and to collaborate and work together to close these gaps. So thank you very much. Gracias, merci, y obrigado.